Postpartum depression is a type of depression that happens after having a baby. It affects up to 15% of people. People with postpartum depression experience emotional highs and lows, frequent crying, fatigue, guilt, anxiety, and may have trouble caring for their baby. So in this video, we are going to talk about treatments for postpartum depression. The video is going to be amazing, so make sure you stick to the end. Postpartum depression is linked to chemical, social, and psychological changes that happen when having a baby. The chemical changes involve a rapid drop in hormones after delivery. The actual link between this drop and depression is still not clear. But what is known is that the levels of estrogen and progesterone, the female reproductive hormones, increase tenfold during pregnancy. Then, they drop sharply after delivery. By 3 days after a woman gives birth, the levels of these hormones drop back to what they were before pregnancy. Postpartum depression can make you feel disconnected from your baby. You may feel as though you don't love your baby. These feelings are not your fault. Other postpartum mental health conditions related to postpartum depression include postpartum psychosis and postpartum anxiety disorders. Here is what you need to know about the other types of postpartum mental health conditions. Postpartum psychosis, sometimes called puerperal psychosis. This postpartum mental health condition develops in around 1 to 2 out of 1,000 people. Postpartum psychosis usually begins earlier than postpartum depression, within the first 2 weeks after giving birth. Postpartum psychosis is distinguished from postpartum depression by the presence of delusions, believing things that aren't actually true, and hallucinations, hearing things or seeing things that aren't there. Other symptoms can include intrusive thoughts and an inappropriate response to or disinterest in one's child. Postpartum psychosis symptoms may change rapidly, with periods of elevated mood being quickly followed by profound sadness or rage. Periods of lucidity are common and not necessarily an indicator of recovery. It is thought that postpartum psychosis often represents an episode of bipolar illness. Postpartum anxiety disorders. Anxiety disorders are also common following childbirth. You may find that you are so anxious that you find it difficult to care for your baby or yourself, such as being unable to eat or sleep. Some people find themselves afraid that they will harm their baby. In fact, according to the Women's Preventive Services Initiative, WPSI, which is a national coalition of women's health professionals, anxiety is one of the most prevalent health disorders in the U.S., impacting as many as 40% of women over the course of their lifetime. Anxiety can be caused by a number of underlying issues, including the stresses of childbirth and becoming a parent. Consequently, if you are experiencing signs of anxiety, talk to a healthcare professional. They can administer a quick questionnaire to assess your anxiety and make a referral for care as needed. There is not specific test that diagnoses postpartum depression. Your healthcare provider will evaluate you at your postpartum visit. This visit may include discussing your health history, how you felt since delivery, a physical exam, pelvic exam, and lab tests. Many providers schedule visits at 2 or 3 weeks postpartum to screen for depression. This ensures you get the help you need as soon as possible. They may do a depression screening or ask you a series of questions to assess if you have postpartum depression. They'll ask how you're feeling and how your baby is doing. Be open and honest with your provider to ensure they get an accurate picture of your emotions and thoughts. They can help distinguish if your feelings are typical or symptoms of postpartum depression. Your healthcare provider may order a blood test because postpartum depression can cause symptoms similar to many thyroid conditions. Before we move on, support us by hitting subscribe and the bell icon to get notified when we post new videos. Now let's get back to our topic. Postpartum depression is treated differently depending on the type and severity of your symptoms. Treatment options include anti-anxiety or antidepressant medicines, psychotherapy, talk therapy or cognitive behavioral therapy, and support group participation. The class of medications prescribed for postpartum depression is known as selective serotonin reuptake inhibitors, SSRIs, which include fluoxetine and sertraline. Also effective is venlafaxine, a serotonin norepinephrine reuptake inhibitor, SNRI. Several studies have suggested that sertraline has little risk to breastfeeding infants. However, there are no long-term studies of the health or behavior of infants exposed to SSRIs through breast milk. In contrast, evidence shows that some tricyclic antidepressants do not have adverse effects on breastfeeding infants, including long-term studies that suggest that no developmental problems are found. Postpartum depression is a serious and debilitating condition. and you should not attempt to treat it without a healthcare professional's input. But at-home practices, like eating a healthy diet, regularly engaging in gentle exercise, practicing meditation or yoga, and spending time in nature may help you feel better, especially when used alongside traditional treatments like medication and therapy.